Hi, my name is Corinthians, and today I'll be going over type 1 diabetes mellitus. So the formal name is actually diabetes mellitus, but there's different types of diabetes. So I want to emphasize that I'm going over the autoimmune disorder, which is type 1. Type 1 diabetes has a couple different nicknames, one being juvenile diabetes, just because most of the patients that are diagnosed were diagnosed either as a child in their adolescence or as a young adult. And this is not to say that type 1 diabetes does not develop in older patients. It just means that most of the time it is clinically diagnosed whenever individuals are very young. And then insulin dependent diabetes just characterizes type 1 diabetes because individuals cannot produce their own insulin. They rely on exogenous forms of insulin. So, beginning with diabetes, it's a Greek term that translates to siphon and it refers to the flow of liquid through tubes. So, when you think of that, just think of urine. And then we have mellitus, which is a Latin term for sweet. And if you put those terms together, we have sweet urine. And just a short breakdown of sweet urine, whenever the kidneys are absorbing different molecules, it'll reuptake glucose and store it in our body to use for later. But individuals who have type 1 diabetes or even type 2 diabetes, the body does not reabsorb this glucose, it just releases it in the urine. So that's where they get this name from. Um, but I'll talk about that more again later. So, what is type 1 diabetes? It's a chronic autoimmune disorder in which there's an immune response to the pancreas, or more specifically, the pancreas cells. And beta cells are a subsite of these islet cells, and they secrete insulin. Insulin is a very important hormone because it allows glucose uptake into our cells. And without that, we have a high level of sugar in our bloodstream. And that's just a term known as hyperglycemia. But overall, type 1 diabetes is a type 4 hypersensitivity disorder because the T cells are um, very involved in the destruction of these beta cells, and it's a delayed response, meaning it takes a couple weeks for this response to occur. So, symptoms. Most people do not know they have type 1 diabetes until they have DKA or diabetic ketoacidosis. And this is just because when the body cannot break down glucose, it'll start to break down fats instead. And a byproduct of breaking down fats is acid. But when there's a lot of acid being created due to this breakdown of fats, there can be complications because a lot of it is not it's not ideal to have lots of acid in our bloodstream or in our kidneys. So this leads to polyuria, which is frequent urination, just like in the name, sweet urine, except not only is the urine sweet, but it has a lot of acid in there. And then we have polydysphia, which is um, extreme thirst, and then weight loss. It could be weight gain as well, but just an overall appetite change, nausea, fatigue, and confusion. So causes, we have genetic factors and environmental factors that come into play. The HLA complex, which is the MHC in humans, there are different genes that allow individuals to be predisposed to type 1 diabetes. And this just causes the B cells to have an increased binding affinity to self antigens. And these self antigens are reflected on the MHC, on class 2 MHC, and shown to T cells. And then we have polymorphisms in the insulin promoter gene. And I thought it was really cool to mention uh, I put deletion of insulin reactive T cells because there are some people who have predisposed genes for type 1 diabetes, but they never get it because their body does a really good job of clearing these T cells that are very reactive to these beta cells in the pancreas. Um, for the environmental factors, we see that um, young children or even babies who have a lot of viruses that target the gut or the body or the intestines. Sorry, I said body. The intestines. This just disrupts the immunological tolerance to self antigens. poor gut microbiome as well, because the body's not able to have that barrier against different bacteria, causing more infection. And then later on down the line, there's something going on with the immune response to their own cells. So, Eisenbarth's model. So, George Eisenbarth is an American endocrinologist, and he created this model in 1986 that everyone just decided to adopt and says, yes, this is great, because he did a great job of breaking down the different phases of type 1 diabetes. So, stage 1, we have normal blood sugar levels, but if there were advanced testing done, we can see that there are 2 or more um, pancreas cell antibodies that are, um, directed to these cells. And then stage 2, these autoantibodies begin to damage the beta cells. So we do see some changes in blood sugar. And in stage 3, we have symptoms of DKA, because now we have little to no insulin being produced by these beta cells because these autoantibodies are damaging them. So I just wanted to show um like the a clear difference between stage 2 and stage 3. You can clearly see that the pancreas is bigger here, and then we lose some mass as the beta cells are dying. And then we see the autoantibodies there just going in there, and they're targeting these beta cells, not B cells, but beta cells. And then we get here, and you see that these beta cells are actually dying. So mechanisms of induction. So there is some molecular mimicry here, where we see the B cells are going into the pancreas and they recognize these pathogens, or they recognize these proteins to be pathogens, and they're not. So the B cells begin to produce plasma cells that form these antibodies against the beta cells. The B cells present these antigens to the T helper cells, and the T helper cells are activated and produce cytokines. And these cytokines induce inflammation. And I don't know why I didn't complete this second point, but these cytokines recruit more cytotoxic T cells, so increases the destruction of beta cells. So we have 4 main autoantibodies that are usually targeting the proteins of beta cells. So they go into the beta cells and they're like, no, we want to get rid of this protein. And as a result of that, these beta cells die, and they're destructed, and then they can't secrete any insulin. So I'm not going to sit here and bore you guys trying to name these out, but we have IA2, we have GAD65, zinc T8, and then we have IAA. Continuing on with the mechanisms of induction, the innate cells do play a role. Macrophages and natural killer cells, they work with the cytotoxic T cells to go ahead and destruct beta cells. And then we have neutrophils that play a role in secreting cytokines and just ramping up that inflammation. And then dendritic cells, they they do just what the B cells do, and they present these antigens to the T cells, and it just keeps going. Um there's just cytokines being secreted. Yeah. So cytokines. There are 2 groups of cytokines, one pro-inflammatory and 2 anti-inflammatory. And if you notice, you can see that there's way more pro-inflammatory, kind of directing different cells to further destruct beta cells. So clinical diagnosis. There are 3 popular tests, or 3 main tests. The first one is actually the main test, and this just measures the blood sugar that are attached to the red blood cells, more specifically the hemoglobin in the red blood cells, and you can see the amount, the range, between up to 2 to 3 months, right? So this is a really good test, but some individuals are not able to take that if they're pregnant or if they have any other health conditions that might affect their blood sugar. So we have the random blood test, which you can take at any time of day. And at any point, if your random blood test is at 11.1 millimolar per liter or over, then you have type 1 diabetes, or diabetes in general, right? And then we have fasting blood sugar test. We This test can be done, but you have to fast the day before. And then in the morning when you take it, if your blood sugar is at 7 millimole per liter or higher on two separate occasions, you have a positive type 1 diabetes test. So treatment, since your body cannot produce its own insulin, of course, exogenous insulin would be the best treatment, but now, that's not the only way you combat type 1 diabetes. You also have to be very rigorous in your diet, make sure you're taking the right amount or making sure you ingest the right amount of nutrients because a lot of people who have type 1 diabetes are at risk for having hypoglycemia because these the insulin injected are taking these sugars and now you don't have enough in your body and that can cause other complications. Um, but blood sugar monitoring is very important because it's like you almost have to it's very important. I know it's exhausting for people with type 1 diabetes, but you just have to be very, very mindful and keep track because DKA is very bad. And then long-term untreated diabetes can cause like heart failure, heart disease, kidney failure, um, nerve damage, all of that. So incidences. I got this from the Type 1 Diabetes Index thing. In 2025, there's approximately 9.5 million people living with type 1 diabetes, and this is a global number. And then clinical diagnosis, as I mentioned in the beginning, they're usually the greatest in ages 10 to 14. That's when um, children are more likely to show the symptoms. Like if they're not having, uh, if they're using the restroom a lot, if they're always thirsty, or if they're not putting on weight like they should, as growing children should, it's really a big indicator. And then incidence is actually rising, and this is a global number once again, 15 new cases per 100,000 people. So research and future outlook. So there is a drug out there. Obviously it's not um well it's approved, but it's not like distributed on a very extreme level because there's some more research that needs to be done. But this drug was, I'm sorry, I cannot say the name, but this drug was very effective in mediating different autoimmune attacks that happen on the beta cells. And if we're able to figure out different ways to prevent our um our cells to not attack our beta cells, then we have a really, really, really good chance at maybe finding treatment for for type 1 diabetes instead of just having therapy like insulin. But the goal is to have immune therapy and then beta cell protection so that we're able to stop the body from attacking the beta cells, but also have the beta cells flourish so that we can secrete insulin. So here are my sources, and thank you guys so much for listening, and I look forward to hearing your questions and see if I can answer them, but thank you again.